Encik Azlan here.
Yeah. Hi, how are you?
Heading to CARiNG Pharmacy, right?
Yep, that's right.
Okay. Wow, balik from hospital, straight to pharmacy ah. Why ah? Here got no medicine ah.
I'm just here to see the doctor actually to get my prescription. It's more convenient for me to get my medicine from CARiNG.
Hey, but why more convenient? You have to go to 2 places, right? If it's me, I think I forgot to take my medicine already.
Oh, I use my health record in the CARiNG app. Everything is at my fingertips.
Wow, got such a one ah. What does it do? Can you share with me more?
Oh, it's quite easy actually. Now, let me explain. My health record is an electronic record system that helps me record all my medical data, including the medication I'm taking. It helps me better manage my health because it allows the pharmacist to consistently review my medication. The doctor can also better understand my condition by looking at my health record. For example, they can check my blood pressure and blood glucose readings. So convenient, right? Saves the doctor time on looking for files too. Also, my health record helps to streamline my medical care between all parties. Don't worry, it is very safe and secure to keep all our medical data private and confidential. So many features, right? Hey, stop. We're here already.
Oh, let me find parking. I'll join you inside.
Ah, okay. Sure. Manage your health better with My Health Record. Like me. Sign up at your nearest CARiNG today.
Encik Amar here.
Yeah, hi.
Wow, so many medicine ah.
Yeah, need to stock up.
Huh? Then you should know about carrying My Health Record app. Come, I tell you.
Good afternoon, everyone. Thank you so much for tuning in to our Facebook live stream with Piascledine today. My name is Ivy, a CARiNG Pharmacist, and I'm your host for today. I believe many of you are aware of what osteoarthritis is, right? Especially among the seniors. If not, make sure to keep watching because we have an expert to answer on osteoarthritis regarding your doubts and questions. So, if you thought of anyone who could benefit from today's topic, feel free to share this live stream to them and let's learn more about it. We chose to share knowledge on this topic on osteoarthritis with Piascledine300, which is a natural formulation with more than 29 years of clinical-based evidence, and it is considered as a pharmaceutical grade of product that comes from France. Today, I'm very honored to invite a speaker to speak to us today about this topic. He is a senior consultant orthopedic surgeon and associate professor from Universiti Kebangsaan Malaysia. He is an expert in the field of arthroplasty with more than 15 years of clinical experience. So, if you have any burning questions, feel free to leave your questions at the comment box below and we will get them answered by our expert. Without further delay, let's welcome Prof. Hamdan. Hi, Prof. Hamdan. How are you today?
Hi, Ivy, and then hello, everyone. Thank you for having me. I'm very good and ready to go.
Hi, Prof. So how is your practice nowadays? Do you actually see more patients now as the number of COVID cases have gone down?
Yeah, you are right, Ivy. So during our COVID pandemic, we tend to reduce our patient numbers to maintain our SOP and also social distancing.
Mm-hmm.
and also the patient also afraid to come to the hospital because of the COVID. Since we have reducing COVID numbers now, we can see more and more orthopedic patients, including the osteoarthritis, the topic that we're going to discuss today.
Oh, I see. Okay, so Prof, before we dive into the causes and effects of osteoarthritis, maybe Prof can share to us more about what osteoarthritis actually mean?
Uh, Basically, osteoarthritis is the disease that affect the cartilage in the synovial joint. So basically, you can see from this picture on the top right there, the comparison between the healthy and also arthritis. So we have cartilage in at the end of our synovial joint. So what happened in osteoarthritis? The degradation happen because of imbalance between the repair and degradative process, so that it will lead into the changes at the cartilage level, and also secondary changes at the surrounding structure, such as the subchondral bone. It become hardened, and then it can form marginal osteophytes, and then the synovial lining also become inflamed. So all of this chronic degenerative process will lead into symptoms of pain, stiffness, and impaired movement. Basically, that is osteoarthritis in general, Ivy.
I see. Thanks, Prof, for sharing with us about what osteoarthritis is. So, Prof, a lot of customers think that osteoarthritis only happen for those above 60 years old. Is that true? Like, does it affect anyone younger than 60 years old?
Uh, that is the basically it doesn't affect only the people above 65. So from the data, it has been shown that about 67% of patients in the age of over 65, but there is 43% of the patients under 65 years old. It can start as early as 35 to 65 years old. So yes, more and more patient in the age of 65, but the osteoarthritis also can affect in the patient less than 65 years old.
I see. So, guys, so take note, yeah, it's not only for elderly who will be having these symptoms. Even young adults as young as 35 years old, you might have a chance to get osteoarthritis. So, Prof, what are the risk factors of osteoarthritis?
So we can divide the risk factor into the modifiable and also non-modified. So the modified factors is the obesity. We know
Mhm.
that the increased BMI is relatively proportionate to the OA incidence. So you know that we have a lot of overweight and obese patient in Malaysia. So the another modified risk is the your joint injury, previous ligamentous injury, sports injury, or you have the accidents, and also the inflammatory or metabolic disease such gouty arthritis. There is also a non-modified risk factor that you cannot change, such as your genetics. You have a high history of first degree family of OA, then you have a high risk of OA. The increased age, you have increased incidence of OA, and also in the female gender, there is more risk getting osteoarthritis. So that is the basically in general what is the risk for osteoarthritis.
I see. Thanks, Prof. So, can Prof actually share on how osteoarthritis actually affect the daily life of a patient?
So basically, we see the patient, we take history, most of them. The first symptom is the pain. I think the pain started either you have a mild, moderate, or severe disease. In the mild and moderate, the pain usually associated with movement, what we call a mechanical pains. Once
Okay.
patient move or stay walking for a long period of time, climbing staircase, then they have a pain. But if you have a very severe disease, at the end, A lot of patients will having what we call a rest pain or night pain. It means that without movement also, sometimes they have to wake at night because the severity of the osteoarthritis. Because of the pain, they will have a stiffness and also reduce range of movement. All of this will affect their quality of life. They tend to be immobile. Then there is risk of the high risk of cardiovascular because of change in their quality of life.
Hmm. Okay, so Prof, can you share more in depth on how OA, osteoarthritis actually happens, and what are the causes and effects of osteoarthritis?
That is a little bit complex to 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 define it and then to say pathophysiology, but try to summarize based on this slide. You can see that it started with the injury. Either you have a micro, a small injury, or macro injury. It will stimulate stress into your structure inside the joint, which is your cells, your chondrocytes, and also your cartilage, extracellular matrix. So if you have degradation, it will stimulate abnormal joint tissue response. So the cartilage start to degrade, and then the secondary changes into the subchondral and synovium will happen. All of this will lead into the symptoms of the osteoarthritis, pain, inflammation, and less movement that I've spoken just now.
So looks like osteoarthritis actually start off with silent symptoms which we didn't aware of, and then when it actually moved towards to the severe stage, then we will start to have pain and also inflammation, right, Prof?
Yeah, correct, Ivy.
Okay. So now we have heard of how serious and scary osteoarthritis is, right? So, Prof, do you mind sharing with us what are the treatment options available? Like, is there any lifestyle modifications we can do or any medications that can help with the symptoms of osteoarthritis?
So when we see the patient with osteoarthritis, basically we will take history back and then examine if is one we can do a weight bearing X-ray to
Mm-hmm.
classify the patient based on the disease stages, mild to moderate to severe. But in general, so for osteoarthritis, we should start with the patient education. We need to educate the patient about the disease so that they know what to expect, and then they will comply to our suggested treatment. And also, we will combine the non-pharmacologic to the pharmacologic treatment.
Mm-hmm.
Non-pharmacological is the patient is obese, will advise to reduce weight, if possible, to get 10% of reduction of body weight. And also, we will sometime refer to the physio to get the range of movement, and then also to increase the muscle power to minimize load to the joint. The
Mm-hmm.
medication that we can prescribe is the Cisadoa, means the uh, sy- symptomatic slow acting drugs on OA,
Mm-hmm.
such as the Piascledine and also Glucosamine or chondroitin. And then if the patient have pain, we can prescribe them with the analgesics. And then, or we can start with simpler, start with the paracetamol first.
Hmm. Okay, so actually there are many ways to help with the symptoms of OA, but I guess most important is still to start with the modified risk factors. Like if let's say you're obese, you just try to lose some weight first, right? Before we move on to the surgical options, which is like more severe one, right, Prof?
Yeah. We start the
Mm,
simple one first. I think
exactly.
the keyword here is you need to get the treatment early so that we
Yes.
can prolong your joint before we
Mm-hmm.
do invasive surgery to your osteoarthritis.
Correct. Yeah, prevention is always better than cure, Prof. Yes.
Yeah.
So speaking of CISA-DOA, Prof, can you share about what Piascledine 300 actually is?
So I can show you. This is the medications. I think in the picture also there. This is from France. It has been 29 years. the first international brands among the Sisadoa. So it is a unique formulation from the avocado and soya bean, and it has been a good track record of the safety and efficacy of Piascledine. So basically, it has ingredient of avocado 1/3 and soya bean of 2/3. So it's a very unique molecule because the term of ASU, avocado soybean unsaponifiable. I think we will discuss what is the definition of unsaponifiable avocado and soybean is.
Oh, so Prof, I heard some complicated word here, unsaponifiable. So what does it actually mean? And why can't we just eat soya bean and avocado directly? Isn't that easier than consuming Piascledine?
I think it is easier to eat the fruits, but the molecules that unique in this Piascledine is the molecules that not involved into the making of soap. You know, in every plants, about 98% of the molecules you can use to make a soap, but the unique 2% that is present in the Piascledine is the molecules that has been used to make the Piascledine. So the unsaponifiable means that the molecule that not used to make a soap from the plants.
Oh, I see. So it's actually a very, very rare patented ingredient from Piascledine. So it's definitely different from taking avocado and soybean, right, Prof?
Yeah. It has been, you have to go about 15 stages, and then you have to go about 50 inspections before we make a Piascledine. So that is so unique of this medication.
I see. So looks like we still have to purchase Piascledine in order to treat the symptoms of osteoarthritis. But
Yeah.
fret not, yes, exactly. So fret not, we are actually giving away 3 boxes of Piascledine today. If you manage to answer the question, pin at the comment box below. So the question is, what are the 2 main ingredients in Piascledine 300? So don't forget to hashtag CARiNG Pharmacy and Piascledine along with your answer. We will then select and message the winners with the most accurate answer after this session. You can also like, share, and tag 3 of your friends to increase the chances of winning. So if that's the case, Prof, can we know how Piascledine 300 actually help to improve joint and reduce pain and inflammation?
So as I said before, joint is a unique structure. It consists of the cartilage and also its surrounding structure. The good things of Piascledine, it can act into the different levels of the structure. At the cartilage itself, it will prevent degradation, and it will stimulate cartilage formation. In the subchondral bone, also below the cartilage, it will prevent sclerosis formation and prevent bone resorption. And the synovial lining also, it will reduce molecules that can stimulate inflammation. So the unique is the Piascledine also has been studied for long, that you can see from the graph here that you can expect good pain relief after about 2 months taking glucosamine. And also, once you have a good pain relief, you can expect your function also will be improved. So that is the short term of the effect of Piascledine. But we want is the long term effect is that the after you taking about 2-3 years, you can expect joint space narrowing will be reduced, and also there is an effect of indirect effect of structural modification benefit of Piascledine. So it is also listed into the CPG of our Malaysian guideline in management of OA, and it has a halal certification. So that is good news for the Muslim patients.
I see.
So another thing is the things that I want to share, that this thing, the survey published by this IQVIA, this is a top brand of musculoskeletal OA, and it has the highest quantity sold internationally. So you can have a good track record in clinical and also in the quantity of the medication sold internationally. Also is a top brand. So is I think is can a good product.
Thanks, Prof, for sharing this. So actually, how do patients take Piascledine 300, and what is the recommended dosage for patient with osteoarthritis?
So from the each box, I think they have 30 capsules. So you can take, this is the easiest medication to take only once a day after meal to increase your absorption. So if you buy a one box, then it will provide you for a 1 month course of treatment. So, but to see the progress, you need to take to see the effect at least 2 months after taking your Piascledine. You can
I
expect
see.
a symptom changes.
Oh, okay. So should the patients actually take this before food or after food for better absorption, Prof?
After meals, after food.
After food, yeah.
Yeah.
Okay, so it's basically is one capsule a day after food, and customer can actually take it for a period of 3 to 6 months to start to see the improvement, right?
Yeah. But you can expect improvement up to 2 months. You can see the effect.
I see. Wow, that's really amazing about this product. Okay, so Prof, regarding this, right, I have one interesting question. So it's concerned about gout patients. So can actually gout patient take Piascledine 300 as it contains soybean extract?
So some patient will ask because we are taking a soybean product, but from the study it has been shown that no problem after you taking Piascledine, especially in gout patient. If you do a blood taking after 2 months taking, it doesn't have any changes in your uric acid level. On top of that, there is also no problem in the kidney and also liver function. So it's a safe product, and you don't worry, especially for gout patient.
I see. So basically, it is a safe and a safe supplement for a long-term consumption. And with regard to Piascledine, right, does it have any interactions with any drugs? Because in my practice, right, I see a lot of elderly patients, and usually they are on different type of medications, right? So is it safe for them to take Piascledine together with any other medications, Prof?
Yeah, it's safe. No problem. So far, no problem. You
So
can
far, no
take,
problem. Huh?
yeah.
Okay, thank you, Prof, so much for the sharing session. So before we move into the Q&A session, don't forget to answer the question pinned at the comment box below. You might stand a chance to win Piascledine 300. The question is, what are the two main ingredients in Piascledine 300? And I believe we have mentioned a few times, right, Prof, just now?
Yeah, very easy.
Very
Easy
easy
question.
question.
Yeah.
Yeah.
Mm.
Correct. So don't forget to hashtag CARiNG Pharmacy and Piascledine along with your answer. We will then select and message the winners with the most accurate answer after this session. You can also like, share, and tag 3 of your friends to increase your chances of winning. Okay. So, Prof, I have a first question coming from Shirley Tan. Okay. Will sour
Okay.
food or fruits like vinegar and pineapple aggravate osteoarthritis?
So far, there is no foods that can trigger osteoarthritis because osteoarthritis is a cartilage disease. It's not associated with any foods. So it's not like gouty arthritis whereby there is internal organs or you take a lot of peas, high purine product that can aggravate the osteoarthritis. No, gouty arthritis. But in osteoarthritis, is not associated with any foods or any things you take supplement.
I see. So I would say like osteoarthritis is more like a degenerative process, like due to the mechanical use
Yeah,
and
yeah,
long
yeah.
term. It's definitely not related to food, right?
Yeah. It's not really related to the food intakes.
I see. Okay, thanks, Prof. Okay, so I have next question from GH Tan. So it says here that osteoarthritis affect joint. So can it also affect the ankle? What about pain on abdomen area for osteoarthritic elderly patient?
So osteoarthritis, it will affect the synovial joint. Synovial joint is any large joint that has articular cartilage. It
Mm-hmm.
includes the hips, the knee, and then also the ankles, or a small joint of the hands, and also sometimes the synovial joints in the facet joints of the spine. So
Mm-hmm.
as we know that in our setting, more osteoarthritis affecting knee joints.
Knee
Survey
joint.
has been shown that about 65% is affected the knee joint compared
Mm-hmm.
to the probably the Western countries. They probably have more osteoarthritis of the hips. So
Mm.
yes, the osteoarthritis can affect a large joint as a knee and the hip. It can affect the ankle also,
Ankle as well. Mm.
and hand also.
I see. So it basically can affect any parts of the body with joints, right?
Yeah.
Okay, Prof. So I have next question from Tan Estek. Is there any side effects for long-term consumption of piascledine?
So from the study, it has been shown that it is safe to take for periods for a long time because it doesn't have any side effects. You can
Mm-hmm.
see from my slide just now, taking a piascledine up to 2 to 3 years, you can expect that there is a reduction of joint space narrowing, means that you can delay your progression of arthritis. And if you don't want to take, probably another way to take it, because the piascledine have a 2 months carried over effect after you take about 6 months. You can take a 6 month and then you rest for 2 months. You still have a carried over effect of 2 months, and you continue back. It doesn't have a problem if you take for a long time, non-stop, no problem.
Yeah, basically piascledine is just contain natural ingredient. It's not like drug like painkiller. So it's a natural formulation that is safe to take for long term.
Yeah, the particular for painkiller, if you take for long time, you have your gastrointestinal risk, such as your ulcer, or you have a cardiovascular risk. You can have your heart problem. So that is the danger of taking prolonged painkiller or analgesics. But it doesn't have any side effect of the gastrointestinal or cardiovascular in the taking of piascledine.
Yep, exactly. Because like in my practice, right, I do see customer just taking painkiller on a daily basis. So I think it's important to actually find out like what are the causes of the pain that you are having instead of just popping in painkillers, right?
Yeah. I think
Yeah,
the best way is to consult your doctors, get
correct.
a proper examination so that the doctor can advise what sort of medication. The
Yep.
NSAID is not good for, I think, for any. If you use for short term is good. If you take
Mm-hmm.
for a long time, there will always a risk of your kidney, your gastrointestine, and also the cardiovascular. So
Yep.
if possible, we want to minimize taking all NSAIDs or analgesia.
Yes, so like what I say, it's still better to go with a prevention first. So at the first sign of like any pain or cracking sound, just go and seek medical help from the doctor.
Yeah.
Okay. So, Prof, so we have next question from Latara Soon. Glucosamine. So she was saying that glucosamine and calcium does help with OA, osteoarthritis. Is that really true?
Okay. There is a two different modes of action there. Glucosamine is the supplementation for osteoarthritis. Calcium is not for joint. Calcium is for your bone density. If you are elderly or postmenopausal, you need to take calcium and also vitamin D. So you can't take the calcium alone. You need to take calcium with vitamin D. There is different action. One acts in the joint, another one acts in your bones to increase your bone strength or bone density. One for OA and another one for probably osteoporosis.
I see. So to recap what the doctor has said, basically calcium and D3 is more for the bone strength. So it's for those who are having at risk of osteoporosis. Whereas like glucosamine or even Piascledine 300, this will be more on the joint function, like to reduce the pain in the joints and reduce the inflammation in the joint. Okay, so Prof, we have quite a few questions here from the audiences.
Good
So
response.
So the question from Josephine Yu, can someone with high blood pressure, cholesterol and diabetic take Piascledine?
Can, no problem, because it doesn't
Mm,
affect any of the medication for diabetic, hypertension, or dyslipidemia. So it like I just said before,
mhm,
taking a long term of piascledine doesn't change your kidney or liver function.
mhm.
So doesn't change your glucose control. It's safe to take, especially in diabetic patient. No problem. I think not associated with any problem with any medical illness.
Okay, yeah. So basically, anyone can take it. Like even young people who are having like joint pain, osteoarthritic pain, you can actually start consuming it, and it's actually easily available in any pharmacy as well.
Yeah, yeah. And
Okay.
easy, is single dose.
Yes, exactly. So it's a single dose, one capsule a day after a meal.
So patient
So
like it because you can take only once a day compared to probably another supplementation. Probably you need to take more than once.
yep, exactly. Okay, so we have question from Cheryl Chong. If you take piascledine, do we have to take glucosamine conjointin? So it's another supplement actually.
So that is part of the question that usually patient ask.
Mm-hmm.
But if you take both, then probably we don't know which one acts to your osteoarthritis problem.
Mm-hmm.
You most of the patient, I will ask them to take either once, but the correct thing is not to take 1 month and then change to another medication, because we know the term of symptomatic slow acting drugs on OA, it will take probably the best way to see whether your medication is effective. You take about 3 to 6 months, the minimum probably 2 to 3 months to see the progress. If you see that your medication, your current medication doesn't have any changes to your symptom, probably it's not work. So you can either change to another Cisadoa, or in some patient, if they have, I think the financial problem is not there, probably you can combine. But for me, I prefer for you to take only single Cisadoa first, see the progress. If not, probably you shift to another, or you can combine after that.
I see. So what Prof meant is that just stick with one type of regimen first, like maybe
Yeah.
for a period of 3 to 6 months. If this is not good for you or it's not good enough, then only we switch to another regimen.
Yes, yes, correct, Ivy.
Okay, thank you, Prof. So I have another question from let me see. Okay, from Eunice Leon. This is a very interesting question. Yeah. So she was asking, anyone with ovary cysts, yeah, can she take piascledine because it contains soybean oil, right? So is it suitable for her to take? Will it affect the hormone level?
So far there is no case studies or case report with the soya bean and also ovarian cyst. I think probably there is in the society that if you take a lot of soya, then probably you have the ovarian cyst. But so
Mhm.
far is doesn't has any case report on taking piascledine causing ovarian cyst. That is
Mm,
the answer that I can give at the moment.
I see. Okay, thank you. Oh, so Prof, I have a question from Ama Mazuki. So he's asking what is the difference between osteoarthritis and rheumatoid arthritis?
Oh, it's two different things. In
Mm,
osteoarthritis, we have discussed just now, is the degradative process or degenerative process. The layman term is wear and tear of the cartilage. But
yeah.
in rheumatoid arthritis, there is autoantibody, what we call the rheumatoid factor, that will act into the patient's synovium,
Mm-hmm.
and it will stimulate inflammation. Later on, it will cause joint destruction. So one is the osteoarthritis is the degenerative process. The
Yes.
rheumatoid arthritis is the autoantibody that presents in the patient's blood. Actually started with the synovium. Later on, it will destroy the joint itself. So it's two different things and two different type of treatment for that disease.
I see. So maybe we could say that with osteoarthritis, at least it is still preventable, right? But with rheumatoid arthritis, because an autoimmune disease, it's kind of difficult to prevent it. Is that right, Prof?
Yeah, you can prevent, but with the advance of medication now,
Mm.
even with rheumatoid arthritis, we can have a lot of medications that can treat your rheumatoid arthritis. Not as
Mm.
before. We have a lot of good immunologics products,
Mm-hmm.
immunomodulators, immunosuppressors that can
I
treat the
see.
rheumatoid arthritis. So although you have to take for your life the medication, but it
Mm-hmm.
can prevent the main thing, it can prevent joint destruction.
Yes, exactly. Okay, so regarding since someone asked about rheumatoid arthritis, right? So is actually Piascledine 300 suitable to be taken to prevent rheumatoid arthritis?
No. I think rheumatoid arthritis is different modes of treatment. Uh,
Mm-hmm.
so the diagnosis also, you have to take history. Most
Yes.
of them started with the small joint pains, and then there is a criteria.
Mm-hmm.
You can have early morning stiffness more than 15 minutes, involve a
Yes.
small joint of the hand, and sometimes you have a swelling of the hands. And also,
Mm-hmm.
the diagnosis is based on your blood test. You need
I
to send
see.
your rheumatoid factor or NTCCP. It's not like
Mm-hmm.
osteoarthritis. We can get the history and send for X-ray, but in
Mm-hmm.
rheumatoid arthritis, we need to send your blood test.
I see. Okay, so basically Piascledine 300 with avocado and soybean extract is only indicated for treatment of osteoarthritis, Prof.
Yeah, correct, Ivy. For
Okay,
osteoarthritis.
thank you. Okay, so we have another question from Tan Zach. What does Prof think about chiropractic on osteoarthritis? Will it help actually?
So chiropractic is the term manipulative treatment. So part of the non-pharmacological treatment.
Mm.
But the main thing is in all chiropractic, before you go for your chiro, you need to consult your doctor to see
Mm.
whether is it safe for you to go. Some of the patient, they tend to be in retrospective. They went to the chiro first, and then later on come to see the orthopedic surgeon. So the best thing before you go for chiropractic, you need to consult your doctors, because for us we can see the patient and then assess the patient, do an X-rays, and then we can advise accordingly whether it's safe or not. We worried that if the patient have a deformed OA, probably it can cause with the chiropractor can cause ligamentous injury, or in
Mm.
the osteoporotic bone. If you manipulate in the very osteoporotic bone, it can cause fractures to your bones,
Wow,
periarticular bones. So
I
better
see.
consult, get the or X-rays, or ask your doctor. I think if you have early disease, probably can, but if you
Mm-hmm.
have a osteoporotic or you have a very deformed knee, it's dangerous to go for chiropractic.
Okay. Thank you, Prof, for the explanation. So, another question from Hazel. Is there any natural treatments for osteoarthritis?
So far, although the Piascledine from avocado and soya, but it has a very unique molecule that you cannot treat OA just by eating fruits or any foods. So far, I don't know any foods that can prevent osteoarthritis.
Okay, I see. Okay, so we have one last question from our audience today. So from Lim Ha Chu. So if a person take calcium and calciferol for long term, is it actually bad for health? Does it affect kidney?
So that's why if you take calcium and rocaltrol, we need to see your calcium level to prevent formations of kidney stones. So
Mm-hmm.
if you take for long taking of vitamin D and calcitriol, better for you to see doctors. At least you see your calcium level and also kidney level. So there is a risk, but a very low risk. But the best practice is you take a prolonged calcium and rocaltrol. You need to be investigated for your kidney or calcium level. At the meantime, despite calcium and rocaltrol, you have a lot of groups of medication that can prevent osteoarthritis, such as your bisphosphonate, and then a lot of injectable medication at the moment. So not only calcium and rocaltrol. But if you want to take calcium rocaltrol, get your blood test to make sure you don't have any problem with your kidney stones later on.
Okay, thank you, Prof, for the explanation. So I think that's the end of our sharing session. For the viewers who are joining halfway today, remember to answer the question pinned at the comments box below, as you might stand a chance to win Piascledine 300. The question is, what are the two main ingredients in Piascledine 300? So don't forget to hashtag CARiNG Pharmacy and Piascledine along with your answer. We will then select and message the winners with the most accurate answer after this session. You can also like, share, and tag 3 of your friends to increase the chances of winning. So before we end our session, Prof, what is the one last message that Prof would like to share with our audiences today?
So my message is, if you have experienced any pain in your joints, do consult your doctors, either your GPs or the orthopedic surgeons, so that we will take histories, examine you, and also we will send you for X-rays to see what sort of stage of osteoarthritis that you have. So in the summary, probably the best is to get the treatment early. So better you get early treatment, so that it will prevent of your progression of osteoarthritis, and also from that we can advise on what sort of treatment that we can start on you. We start the holistic approach, your non-pharmacological and also pharmacological treatment.
Mm-hmm. Okay. So thank you so much, Prof, for your sharing session today. It's a very insightful session. I believe all our audiences have learned a lot today. So thank you for joining us today, Prof.
Okay, thank you very much, Tan Ivy. So I can see a lot of questions. In fact, it's still coming. Hopefully, I have answered the question and also satisfied all our audience. Thank you very much, CARiNG, and thank you very much, Piascledine, for inviting me for this live session.
Okay, thank you, Prof. And don't forget to like CARiNG's Facebook page and share this video with your friends and family who you think you can benefit from this Facebook live session. Thank you. Bye-bye.
Okay, bye-bye.